As states continue to shift public health rules for people and businesses and increase COVID-19 testing, experts say the U.S. is still on track to continue the uptick in cases. Our national investigative team has the latest on states where numbers are going up. Here's Lee Zurich with our COVID-19 tracker.
In the state of Florida, hospital beds are filling up.
Our numbers are continually increasing, and I think that's our biggest concern is obviously capacity.
According to the Florida Agency for Healthcare Administration, at least 56 hospitals have reached ICU capacity.
Where are we going to be in 2 weeks from now?
Last month, younger Floridians were testing positive for the virus. On June 23rd, the median age was 33, but that's gone up to a median age of 40 Tuesday.
Drifted up to 37, 38 years right now. That's the median age. That means that more and more Floridians that are testing positive are likely in the 60 and older category that is most at risk of hospitalization and death.
Yale Dr. Howard Foreman describes Florida, along with Texas and Arizona, as the most troublesome states. But he's also watching California, Utah, Nevada, Georgia, and South Carolina, all states with disturbing trends.
You start looking around, and the more you look, the more you find states that are just starting to take off.
In the last 7 days, the Victoria, Texas area has seen more new cases per capita than any other metro area. Also seeing a high case count, Lake Charles, Louisiana, Charleston, South Carolina, Cleveland, Mississippi, and Corpus Christi, Texas. At the peak of the April outbreak, the country averaged about 32,000 cases a day. Now it's up to 48,000 a day and climbing.
We're still heading to 100,000 cases per day, probably by the end of this month. We'll probably see sometime in the next 2 weeks a number over 100,000. It won't be consistent at that point. And then sometime in August, it'll be consistently over 100,000. And then you're going to start to see deaths creeping up. Right now, we're seeing about 4,000 deaths a week.
While the number of deaths are down across the country, Foreman expects them to rise as more people are hospitalized.
How are they going to flatten the curve, and are they going to be able to do that?
Now, the only way they're going to do it is through either a true shutdown. They won't call it a shutdown. They'll just say they're slowing things down and reversing some measures. But effectively, they need to shut down all indoor sort of congregations of any type. They need to minimize foot traffic where people are coming in contact with one another in any small areas.
Now communities are grappling with that. Some in the hot spots adding more restrictions and closures. Lee Zurich, Valley News Live.
Our COVID-19 tracker also shows hospitalizations coming back up in most states. On average, as a country, our hospitalization numbers are about the same as they were in mid-May. Apple wants to take what some say is the next logical step with your passport and wallet. What it's aiming for in the future is next on Valley News Live, 10 at 10.